Hi, folks. This is Dr. Kat Schreier. We're back with Dr. Stuart Weiss, AskDOCTORSTU, founder of Intelligent Crowd Solutions, worldwide renowned pandemic expert. He was doing pandemics before pandemics were cool. He is one of our speakers on this week's 30 Amazing Trusted Experts on Water and COVID-19, Your Home and Health. Our original interview with him was a while ago, and what we know about COVID has been advancing really quickly, and everything's changing. So we wanted to have the opportunity. Right now, we're gonna record for about 10 minutes. We're also gonna have sessions tomorrow and Friday, so it's Thursday and Friday at 3 o'clock Eastern, noon Pacific, and we'll have opportunity for people to actually join us and ask their questions, or you can type your questions into the groups. If you haven't yet signed up, it's at watercitizen.org/watercovidhomehealth, and I'll post that under this video, watercitizen.org/watercovidhomehealth. Now, Stu, what is new in the world of COVID-19, and what have you been doing? Why don't you explain to folks your background with respect to COVID and what you have been doing since this lockdown started to get people information on COVID?
Absolutely, Kat, and it's a pleasure to be here with you today, and thank you so much for inviting me to these really exciting sessions. We're going to have one today and one tomorrow and one on Friday, as you mentioned. So I'm pretty excited about joining you every day and talking about COVID-19, which I spend every day talking about. As you mentioned, I'm a physician. I'm a board-certified emergency medicine doc, and I've been specializing in pandemic preparedness and disaster preparedness for probably about 25 years.
Wow.
I started doing work back about 25 years ago as part of a civilian component of something that was called the Biologic Weapons Improved Response Program. And we did planning for nasty biologic, and there was a counterpart called the Chemical Weapons Improved Response Program. So between the two of us, the two groups, we did planning for biologic weapons and chemical weapons, and that a lot of the same types of illnesses and issues that we deal with now with COVID-19, we thought about 25 years ago. And then we did lots of pandemic planning back in about 10 years ago when we were very afraid of H5N1 and during the H1N1 pandemic flu planning. So we've been doing that, and now that pandemics is a reality and we're in the middle of one, we have been doing a lot of work with clients around the world, helping them first respond and then now recover from the pandemic.
Yeah. You know, and coming from the water space, a lot of us in the water community, whether it's as water professionals or people serving on boards or their community leaders or whatever, crisis planning is our thing, right? Usually it's things like a contaminant or some kind of contaminant gets in the water supply, or a flood, a hurricane, all that kind of stuff. And it's like, yeah, maybe someday there'll be a pandemic. We see that in all the Hollywood movies, and we haven't really had a big one for a while, but
right.
we're worried about all these other things. But it's kind of, boom, we're right in the middle of it. And not only that, but it's impacting all of us. It's not a localized kind of outbreak like E. coli or something like that. That's the cryptosporidian outbreaks that tend to be pretty localized. This is impacting all the policy leaders, all the engineers, all the decision makers are suddenly finding themselves locked in their homes, not able to get with their teams because we could all be spreading it to each other, right?
Yes, absolutely. So the idea that this is actually a pandemic means that it is a global experience. We haven't had a global experience like this in a long time, especially one as impactful as SARS-CoV-2, which is the virus that causes COVID-19. So this is a nasty disease. And I know some people out there have thought about it in terms of comparing it to influenza, but this disease is not influenza. It has a much higher death rate. It has a much higher long-term problems associated with it, because we're finding that people have long-term lung problems and long-term cardiac problems, or we suspect that they will, because we're seeing damage after people recover on their MRIs and CT scans. So It's a complicated disease that is different than anything we've seen before, and it's pretty concerning right now.
Yeah, you know, and for a lot of folks who are used to thinking in terms of policy and community development sorts of issues, you know, we also read in the direct side that the disease is different, and our society is different as well. And who has access to water? Who lives in multi-generational housing? Who has, you know, no kids at home and a big house that they can sit and work on versus who's got, you know, lots of kids and, you know, and has to deal with homeschooling, has to deal with vulnerable populations, how we're treating our vulnerable populations. And then just kind of the way it's reported in the news of, oh, so many people died today, but it's okay. They were all old people and people who are already sick.
You know, yeah. Unfortunately for us and for our society, when you think about it, there are people, specific groups that are at much higher risk of dying of this disease. And it seems to be a disease different than SARS and MERS and other illnesses. COVID-19 seems to be a disease that disproportionately affects older people. It affects people with underlying medical conditions, and it seems to affect people of color more than you know, other groups of people. So, you know, it's a evolving, complex situation. You know, for those of the listeners that are from Europe and other parts of the world, they seem to have gotten a good handle on what's going on in their societies. Here in the United States, we have not done a particularly good job of responding to the virus in a way that is interrupting the chain of infectivity, that we are allowing the virus to spread through our country on a continual basis. So if you look at the graphs of new cases in Europe, they are having a downward slope it's going down, and some countries are seeing almost zero cases. Some countries are seeing zero new cases. And in the United States, we are seeing somewhere around 30,000 new cases a day, up from 20,000 just last week. So we're heading in the wrong direction.
Wait. So we had 20,000 new cases last week, 30,000 cases this week. So we've had a 50% per day.
Yeah.
So that's the rate of increase. That's not saying it's a 50% increase. That is saying exponentially.
Yeah, it is definitely, it's growing. It's,
wow.
You know, we're not doing a good job in this country. So, and I know some people are going to say, maybe some of your viewers may be thinking, well, that's because we're doing more testing. But in fact, we are doing some more testing, but it doesn't make up for the numbers that we're seeing, one. And number two, we're seeing increased hospitalizations. So people are getting sick, and then they're getting so sick that they need to go to the hospital. And that obviously is not a result of doing more testing. So public health officials believe that this is a real increase,
Right.
that we are seeing a real increase in the amount of disease, because the other thing that's happening is the percentage of positive cases is going up. So when you do more testing, you get more positives and you get more negatives. But the percentage of total testing is getting higher that's positive, which means of all the people you've tested, the people that are positive are starting to grow. So all these factors look like we are right now losing the battle. You know, it's
and we're losing the communications battle.
Yeah.
I mean, we're just
here in the United States. You know, I want to always say that the caveat that that applies to the U.S. We are, you know, of the big industrial countries, we are one of just 3 big industrial countries that are not decreasing our case numbers. It's the United States, Russia, and Brazil.
Wow.
Those are the 3 big countries. Now, there's lots of smaller countries, and there's lots of places in South America and Africa that are not doing much testing right now. But it's amazing to have the U.S. lumped in with Russia and Brazil. And we are by far the #1 worst case load in the world.
Now, you used to be an ER doctor, and in the U.S., you know, we talk about the racial connection, and obviously a huge part of that is where we are with insurance. that
Yeah.
there are so many people who are low income, and you know, a lot has been coming up around Black Lives Matter and everything, looking deeper at the systemic issues around, you know, lack of access to healthcare, lack of access
Right.
to
So we have been talking.
housing, and often the ER is your primary care physician if you
Yes.
have no other insurance.
So, you know, it's been long recognized that there is a healthcare disparity among communities of people of color. So the question is, are people of color getting sick because there's a physiologic difference, or is it just because there's a healthcare disparity, that their baseline medical care is not as good as people of other groups? So I don't know the answer to that question. That'll be one of the things that gets studied as we go along. Yeah, it's definitely so. You know, it's disheartening to watch how the United States is responding, and my colleagues and world leaders in other parts of the world are really dismayed as they watch the U.S. just struggling with our response, our lack of coordinated response. And in fact, and I'll finish on this point today, the New York Times yesterday published an article and talked about the fact that the European Union is thinking of not allowing U.S. citizens to travel to Europe because we're too dangerous. Yeah. Because we have done such a bad job controlling the outbreak here in the U.S. that it's too risky to let Americans travel into Europe. Yeah. Can you imagine that?
I mean, that's
the age? It's
I did have one real quick question. Because one of the first big hotspot was the New York area, New York, New Jersey area. The center of our media outlets, the center of our economic, you know, Wall Street, all that kind of stuff. And they had their up and down, right? They're on the downside.
That's correct.
Does that perception, you know, people were watching Governor Cuomo every day to find out what's going on in New York, and they're hearing, okay, things are better there, but nobody's doing what he was doing now, you know, in other parts of the country, really to the same extent of.
Well, so I wouldn't say nobody.
Okay.
But you know, there are some governors that are taking a very measured, responsible course of action, listening to their public health people. And then there are governors in states that are just not doing that at all. So if you look at the numbers that come out every day, we have now almost 30 states where the numbers are increasing of cases, where the day-to-day caseload is increasing. And that is something that's very, very concerning to the rest of the world. And it should be concerning to us. Remember, 120,000 Americans have died so far. We see, you know, many, many Americans die every single day. And we seem to think that that's okay. And that bewilders me. But thanks. I think, Kat, we will continue this conversation.
Yes, I know you got clients coming up.
Thank you very much for inviting me.
Thank you. Bring your questions. Write them in the chat. Yeah. We'll answer them tomorrow. And thanks so much, Dr. Stu. And lots to cover. Thank you.
Thanks, Kat. Looking forward to chatting with you tomorrow. Good day. Bye-bye.